Ascariasis. Ascaris is the common disease in children. The causative agent of ascariasis is Ascaris lumbricoides, and the geographical distribution is cosmopolitan. It is found in India, China, and Africa of cases. Ascariasis is limited to warm and wet climate, which is ideal for transmission of disease. Ascaris lumbricoides is the intestinal nematode inhabiting lumen of small intestine. It is cylindrical, tapering at both ends. The female is having longer and stouter body than male. Males have curved tail with hook. When an individual ingests the embryonated eggs through food, drink, or raw vegetables, the digestive juices weaken the eggshells and stimulate the larvae to become active. Morphology of Ascariasis. The common symptoms seen are observation of live worm in stools, gastrointestinal discomfort, vomiting, fever. Pulmonary and neurological disorder can be seen due to migration of larvae, intestinal obstruction of food, pneumonitis, eosinophilia, etc. The modes of transmission is fecal-oral route, and the incubation period is of 2 to 3 months. The diagnosis can be done by two methods, direct and indirect. The direct evidence are worm seen in the stool, whereas finding eggs in the stool, whereas the indirect evidence are blood examination, that is eosinophilia, and dermal scratch test. The treatment is piperazine salt, tetramazole, thiabendazole, niribazole, and mebendazole. The life cycle of ascariasis. It is as follows. People swallow eggs in contaminated food or water. The eggs hatch into tiny larvae in the intestine. The larvae burrow into the intestine and travel in the blood to the lungs. After maturing in about 10 to 14 days, they burrow out into the airways where people cough away and then swallow them. Once the larvae reach the small intestine, they grow into adults. Adult Ascaris worms live in the small intestine of humans, where they mate and lay eggs that pass in stool. The egg passes